You know, the idea of losing a tooth and then having to wait for months to get a replacement, it's a pretty common fear, right? But what if you could shrink that whole timeline down from months to just a single day? Well, in this explainer, we're diving into the technology that makes getting a tooth in a day not just a cool idea, but an actual reality. Seriously? Think about it. You lose a tooth, maybe one that's right there in your smile. The old way means months of waiting, feeling self-conscious about that gap. But what if you could walk out of the clinic with a tooth already in place, ready to face the world again? That's the incredible promise we're going to unpack today. So here's our game plan. First, we'll talk about the old waiting game. Then we'll get into the one-day solution. After that, we'll check out the amazing digital blueprint that makes it all possible. Figure out if this is the right fit for you, and finally, map out what the road to recovery really looks like. Okay, so to really get why getting a tooth in one day is such a massive deal, we first have to rewind and look at the old way of doing things, what I'm calling the implant waiting game. This slide just lays it out perfectly. Traditionally, you'd get the surgery, and then you'd face a 3 to 6 month wait with a gap, while everything healed up. But with this new method, immediate loading, the healing still takes the same amount of time, but you get a temporary tooth on day one. You are never left toothless, and that right there is the absolute game changer. So, how in the world do we skip that awful initial waiting period? Well, that brings us right to the modern solution, a special protocol called immediate loading. Immediate loading is pretty much exactly what it sounds like. It's this advanced technique where a dental implant is placed, and then, almost right away, usually within the first day or so, a fixed temporary tooth is attached right on top. No waiting, no gap. It's kind of wild when you think about it. And the benefits for you, the patient, are immediate and honestly, pretty profound. Your smile is back on day one. That's a huge confidence boost. You don't have that social or professional downtime where you're trying to hide a gap. You can speak and eat, carefully of course, a lot sooner. And the temporary tooth even helps guide your gums to heal in a way that makes the final result look incredibly natural. So by now you're probably asking, okay, how is this even possible? How can it possibly be safe to put a tooth on a brand new implant? Well, the answer is all in the prep work, in some incredibly precise digital planning. The whole process is like creating this super accurate digital blueprint of your mouth. It all starts with a 3D CT scan. Think of it like a really detailed three-dimensional X-ray to map out your bone structure. Then they create a digital model of your teeth and gums. Now, here's the amazing part. The dentist actually performs the entire surgery virtually on a computer to perfect every single angle and depth. And finally, a custom surgical guide is 3D printed that ensures the real surgery perfectly matches that perfect digital plan. So what does all this tech actually mean? It means all the guesswork is just gone. The surgery becomes predictable, totally controlled, and completely tailored to your unique anatomy. That precision is the secret sauce that makes it safe to put a tooth on that implant right away. Now, as fantastic as all this sounds, it isn't a one-size-fits-all solution. So let's get real for a second and talk about the requirements to see if this procedure might actually be right for you. So, who's the perfect candidate? Well, as you can see on the left, it's typically someone with plenty of good quality bone, someone in good overall health, and often someone who really needs a front tooth replaced. On the flip side, things that can be roadblocks include severe bone loss, health issues like uncontrolled diabetes, or habits like heavy smoking, all things that can ramp up the risks. But here is the really encouraging part. For the people who are good candidates, and when the whole thing is planned and done by an expert, the success rates are incredibly high. We're talking over 95%. This isn't some experimental thing. It's a proven, reliable science. All right, so you've had the surgery, you've walked out with your new tooth. What happens next? Let's take a look at that final, crucial stage, the road to recovery. Okay, listen up, because this is probably the single most important thing to get about the recovery. That beautiful new tooth you get on day one, it's temporary. It looks fantastic, it helps you speak, but it is not for heavy chewing. The implant underneath is still healing, and you have to be really gentle with it. This timeline gives you a really clear roadmap. The first few days are all about initial healing, and a soft diet is absolutely key. Then, around week 2, you'll have a checkup. The real magic happens over the next 3 to 6 months. This is when osseointegration happens. That's just the fancy word for the natural process where your bone literally fuses with the implant, creating a rock-solid foundation. Once that's all done, you're ready for the main event, your permanent final tooth. And that really brings us full circle, doesn't it? Thanks to all this digital technology, a procedure that used to be a bit of an art form based on feel has been transformed into a science. It's predictable, it's controlled, and it's customized to give you the best possible result. So I'll leave you with this final thought to chew on. We've seen how a digital blueprint can completely revolutionize implant surgery. The big question now is, could this incredible level of precision planning become the gold standard for every complex dental procedure we see in the future? It's pretty exciting to think about.